So good afternoon. That would work. It is my pleasure to share with you some of the work that we have been doing at WSPS as part of our support of workplace mental health initiatives and working with our system partners as we collectively want to make a change. So one of the things we're asking our clients to consider is this kind of a statement. And we're trying to move the customer or our clients forward to looking at the fact that, you know what, this is about protecting safety and health of our employees. And it has the same kind of value to us, and it should have the same level of importance as dealing with the physical as well as psychological. So we have been on this journey for a number of years. Jamie, you were talking about your 10-year date, and John, yours, and mine's up there too, 30 years. But we've been focusing a lot in the early days in healthy workplace type initiatives and found that that was maybe early days for its time and sometimes too much of a challenge in terms of what a comprehensive model was going to do. But if fast forward to the last 5 years and now recognize that as part of the greater focus both in community, workplaces, and country, mental health is a critical conversation in Canada, and rightly so. My background is management systems, health and safety, and working in healthy workplace type of initiatives over the past numbers of years. I'm the strategy advisor for WSPS for organizational health initiatives, and I actually had the pleasure of helping to write the national standard back with the technical committee and releasing it in 2013. So we're trying to have a conversation with our customers to move from mental health and the mental illness kind of clinical conversation and recognize what is it meaning in workplaces. So we're trying to talk about the fact that, you know what, health is making up both physical and psychological, and there are different aspects of where we can be getting both indicators of good and poor health as we go through life. What we're concerned about is this issue about when our health is not so good, and are we in environments where we could be creating mental distress? And as such, does that give us an actionable point for us to address this? If it continues and other factors contribute, then in the world of our general overall health, we might be talking about folks now suffering from or succumbing to a mental illness type of conversation. So let me change gears just slightly and say, let's talk about this strictly from the workplace setting. In that context, then the squiggly line is representing that this is not a 50-50 split, that probably about 70% of where mental health issues are arising are going to be outside the workplace. But when we think about what's going on in the workplace, let's focus on promoting an environment that's going to prevent mental injury. Let's not get people hurt at work physically or psychologically. And so when it's in that red zone, we're going to talk about it as mental injury, and therefore hopefully in the context of how do we promote a culture that is going to promote and minimize mental distress. And mental distress in the workplace is going to be a precursor to leading to the mental injury issues, because that's our sweet spot. We want to prevent mental harm. And we want to look at factors that are going to be, or dimensions that could be creating this mental distress and leading to mental harm. And this is in our wheelhouse. This is stuff that we have control over and should be able to work on. And then, of course, the third part for this is we also want to resolve and have resolution on where folks have been injured. And no different than our other health and safety program, if it's work-related, we should be investigating. We should be understanding where this is coming from. We've done for years certification training and other health and safety training. We've used these hazard wheels. In the past, when we got to the psychosocial conversation, this is where we usually got crickets in the room because really we didn't know what we were going to talk to. And if anything, we might have talked about things like workload, maybe shift work, and the recent years getting into the violence conversations. But one of the things I think we've had some good traction with is not only in the national standard but elsewhere is when we start seeing these workplace factors now being defined more clearly. Can we take these into conversations and now start to look at those factors as being similar to root cause for physical? If these are the contributing factors to creating mental distress, then we should be looking at ways to try to make sure that we are paying attention to this. I'm interested to hear, because I think each of the speakers has talked about these different levels or different streams. Where is our client, our customer, our workplace in terms of what we're going to be trying to do? And so for us, we use these three streams and say probably many organizations will probably see themselves at the getting started level. And this is going to be around building literacy and vocabulary and understanding stigma reduction and the like. And then for organizations that are in the conversation of recognizing that prevention is more than just awareness, then let's talk about where our workplace factors and our issues might lie. And this is where we get into following our race models and identifying hazards and assessing the risk and then putting control measures in place. And we call that gaining momentum. And then the third area is where firms are interested in the framework of the national standard. So we want to be in the environment of leading practices. And so that's sort of how we set this up. I put this up just to say one thing is that we were not intending to develop new tools and processes specifically. There is lots out there. What we really saw ourselves being helpful to our customers, our clients, is we're a bit of a tour guide. Let's help you on the journey that you're on. Let's help you find out where you are at the start and then what's the destination going to be. And then how do we help you get there? In thinking of that, one of the areas that we have not paid a lot of attention or seen a lot of attention paid to is the role of the Joint Health and Safety Committee member. And it's not sitting in the legislation and probably won't for a while, but where does the committee member fit in to the discussions about workplace mental health? And so while we offer the certification training for our 2 members of our Joint Health and Safety Committee, and we touch on the discussion of mental health, we really were getting the feedback from them, yeah, but when I go back to my committee and we're going to now try to have a conversation, how do I talk about this in a way that gets us into the prevention conversation? And that's to me why mental injury, mental harm is so critical going forward to our stakeholders. Because if we're talking about injuries in the workplace, that's in the wheelhouse of the Joint Health and Safety Committee for conversation, consultation, and support and roles to play here. Well, then why wouldn't we talk about it from the mental harm, mental injury perspective as well? So we are working with Dr. Martin Shane, one of the gurus in healthy workplace, and also one of my colleagues on writing the standard in 2013, but he also is one of the architects of the Guarding Minds at Work programs. So Dr. Shane and our organization are in the final stages now of creating a 1-day training course that we will be providing for Joint Health and Safety Committee members to give them some practical conversation and discussion. So what does an inspection look like when you now start to talk about it from a psychological health and safety point of view? What about this issue of investigation? Because this is not going to be easy, but we need to talk about what do you do when it's work-related? And how do we address that? How do we have conversations? How do we also help committee members who may not have had a chance to look at tools like surveys and understand that these can be as powerful, if not more so, in anticipating and preventing issues and injuries in our workplaces. So we're in the final stages. We are going to hope to be able to release that program in the near future. Stay tuned to the websites and that sort of thing for what's available to support that. I want to plug our other website. So we have the PTSD website, and then the system partners, we also have this thinkmentalhealth.ca website. 2 reasons. We are going to, when the Joint Health and Safety Committee members course now goes live, resources that reside on this website will be linked to it. And so committee members may even have their own radio button where they can say, okay, you took the course, here's the things we talked about in the course, here's actually where those tools now reside for you. The website is intended to be, again, a continuation of the tour guide conversation. So one of the pieces that you'll have in the drop-down menus is there's actually the roadmap conversation, and you basically can do a readiness survey. And you can basically, in your review of the 5 critical factors of where your organizational readiness may be, you can come out and say, okay, I see us in the getting started, we're in the gaining momentum, or we could be in the raising the bar categories. Once that's determined, it gives you now an opportunity to go into the search engine that we have, and we do have more than 75 tools that are available to us. We didn't have to invent them. But we've categorized them in such a way that if you see where your organization is, here's an action plan that you can now follow that can move the getting started conversation forward. So we're giving you the step-by-step protocol and the opportunity to say, okay, and here's what the next level would look like, and here's where you would get further opportunities. So as I go across the drop-down menus at the top, for those that are interested or need to know more about what mental health, mental illness, stigma, and all that aspect of it is going to be, we have a drop-down that links to, again, the appropriate authorities in terms of that discussion. We do talk about workplace investment. So if I'm trying to get that commitment that I'm looking for organizations to buy in, do I have tools that can either help me from the business case point of view, the legal case, the health case, the ethical case? There's resources to support that. What we do also like is this next drop-down. We call it, what can I do now? And the value here is, much of what you've heard today and will continue to hear is this takes time. This is not going to get done by Friday. We have longer term plans and even longer terms in terms of where some of the results are going to be. But there are things that I can do right now. And we are, like others, not wanting to jump to survey. There are things that we can do to build the base first. And so we talk about things like resources that could support lunch and learns. There's 28 very short videos that are whiteboard type programs that talk about not only the psychological workplace factors, but other components of mental health that are 2, 3, 4 minutes long. And the intention is you could show those to a team meeting, you could show those to a lunch and learn conversation, and it gives you a bit of information, but it also asks some questions, and you can use it to lead further discussion as you go forward. This is not a distress or crisis response website, so we wanted to be very careful that if people are pressing the button on crisis, we are clear that this is a prevention website, this is a resources website, this would link you to where you would go for the distress centers or 911 conversation. So we needed to be clear on that. As I mentioned on the roadmap, we can talk about what is there in terms of action plans. The other piece is, if you go down to the middle of the page, you will see a tip of the day, one of the videos being shown as just sort of a way to kind of rotate and keep it fresh. The 75 tools that we have in the database, there is a widget, and I understand from IT that that's actually a real word, so I'll go with it. But this widget will allow you to connect your intranet site to our database. So you don't even have to go to the website anymore. You'll be able to access the tools through the widget and allow you to, again, sort of as offline type of aspect, be able to see your organization take advantage of those tools and use them accordingly. Our intention with the tools was there isn't anything actually out there that's going to make a solution work in 30 seconds or less. So we had to kind of curb some of that expectation, but we wanted practical tools, current tools. We wanted tools that basically have minimal barriers to them. So one of them is price. Just about everything that is on there is free or prepaid. So really there'll be minimal reasons why people could not literally download and start to use the material accordingly. The other piece is much of the tooling or the tool resources are in French English. Our website is English, but the resources do also tend to support a lot of the French conversations as well. So, saying all that takes us to the end of where we are right now. We are continuing to manage the website, and all the system partners are contributing to resources where it's appropriate. For example, John's got Stress Assess and the MIT Toolkit is sitting on this website as well, as ways for us to continue to, again, help clear the road a bit. Where do we want to go? So thank you for your time. I do have a small handout. Maybe consider it your homework, and that is go visit the website. Have a look. Navigate through. There's a Contact Us section on there, so if you're looking for something and you can't find it, let us know as well, and we can see if we can support it as we go further. So thank you very much. Enjoy the rest of the conference.